Okay, we are being live streamed. Okay. I want to welcome everyone to this first meeting of the session of the Health Occupations Subcommittee of the House Health Committee. Our subject matter for today, our topic for today is a briefing on 3 boards within the State Department of Health where concerns were raised about the quality of the interplay between the boards and their and the public at last year's session. And we wanted to get an update on that from the department and from the 3 boards. Those 3 boards are the Board of Nursing, Board of Morticians and Funeral Directors, and the Board of Social Work Examiners. And we will proceed in that order. And there are representatives, I assume, from each of the 3. We will begin with the Deputy Secretary of the Department, Clint Hackett. Mr. Hackett, Deputy Secretary Hackett, the floor is yours.
Thank you, and good morning, Chair Rosenberg, members of the subcommittee. For the record, I'm Clint Hackett, the Deputy Secretary with responsibility for operations at the Maryland Department of Health. Today, for this first segment, I'm joined by Rhonda Scott, the Executive Director of the Board of Nursing. Most of today's presentation as it relates to the Board of Nursing will be led by Rhonda, but I will speak to certain areas specific to the new enterprise licensing and regulatory management system, a new IT system being implemented to support the board's operations. Before we get to the presentation, I wanted to thank you all for the opportunity to present today. I feel like over these past 3 years, the Department of Health and the Board of Nursing have really developed a robust relationship based on collaboration and a shared priority of doing what's best for the people of Maryland. Through the shared partnership, we have together achieved many successes and improvements. Much of these successes, particularly the progress that we've made since last year's presentation to the then Health and Government Operations Committee, will be highlighted today. With that, I hand over to Executive Director Scott to begin the Board of Nursing presentation.
Thank you, Deputy Secretary Hackett, and good morning to all. Good morning, Mr. Chair and members of the subcommittee. Again, my name is Rhonda Scott, and I'm the Executive Director for the Maryland Board of Nursing, and thank you for the opportunity to provide these updates today. So I'm gonna try to share my screen. It says host disabled screen, attendee screen sharing. Are we able to share? Let's see. We have a slide deck that we would like to present, but I'm unable to share my screen. It's not allowing me to do so.
Can you do that, Sam? We're working on it, sorry.
No worries, thank you. Okay. All right. So then I'll just ask for this for you all to move the slides along for us. Is that okay?
Yeah, that's fine.
Okay. All right. Thank you. All right. So I'll go ahead and start. First slide, please. You can go ahead and advance.
Looks like it started.
Okay. Thank you. All right. So I'll just provide a brief overview for some historical context for the subcommittee. So during the 2023 legislative session, legislation was passed giving the Secretary of the Department of Health oversight over the Board of Nursing Infrastructure Operations and Staffing. This law also required the board to participate in an independent evaluation designed to assess operational performance and public accountability. At that same time, the Department of Legislative Services Office of Program Evaluation and Government Accountability also conducted an evaluation of the board's operations. These evaluations identified clear opportunities for improvement across constituent services and communications, technology and application processing, fiscal management, complaint response and investigation, and staffing. I am pleased to report that the board has taken meaningful and measurable steps with the department to address these findings, and today we are here to outline that progress. Next slide, please. Next one. And one more. Thank you. So I think it's also important to note that in 2025, the board voted to continue the secretary's oversight over the board's infrastructure operations and staffing until July 1st of 2030. And this legislation was signed into law in May of 2025. Next slide, please. Next. Thank you. So both evaluations solicited feedback from our stakeholders and constituents. And as you can see, in early 2023, the public feedback that we received was not great. Actually, our Google rating at that time was 1.2. And again, that was basically due to lack of resources, antiquated technology, limited staffing. And so we partnered with the department to immediately work on improving these areas. Next slide, please. Fast forward to now, our current Google rating is 3.6 out of 5. And while we know that's not perfect, there's still more work to be done. There's still a ways to go. We are extremely proud of where we've come and how far we've come in the progress that we have made in the areas of engaging our constituent services and communicating with them.
And this rating is based upon how many people?
I don't have the exact numbers, but I certainly am happy to provide that to the committee. The subcommittee.
Thank you.
Sure. Next slide, please. So the Department of Office of Constituent Services works with the Board of Nursing and other health occupations boards to track open constituent cases. And these are inquiries that come in through the department from constituents about concerns. And as you can see, in early 2023, the board had 24 that were overdue, the oldest being 177 days overdue. And currently we have no overdue cases. They are addressed as soon as they come in, at least making immediate communication to the constituent, letting them know that their inquiry has been received and that a member of the board is working on it and will follow up with them. Next slide, please. Some of the other improvements that we've made, we have upgraded our phone system. So now constituents, when they call in, they have the opportunity to request a callback. They are notified of where they are in the queue. They can also leave a message for the unit that they are calling in for. We've also stood up an Office of Performance Improvement, Quality Assurance and Performance Improvement. We're actively hiring for a director to oversee that unit. We currently have a manager who has already begun conducting internal audits. We've developed standard operating procedures for more standardization across the board and also to help with efficiency of onboarding new staff. Next slide, please. And with that, I will turn it over to Deputy Secretary Hackett.
Has a third party reviewed your improvements?
Not to my knowledge, no.
Okay, thank you.
You're welcome.
Thank you. We can move to the next slide, please. Thank you. Okay, so these are some of the updates that have occurred since the department has collaborated with the Board of Nursing. Effective June of 2023, the board reconnected with us after our cyber insecurity incident. And by doing so, we also strengthened the network connectivity, meaning that there's less issues, less downtime with the board's network infrastructure by doing so. We did also work to upgrade the board's physical and information security posture. Specifically, we have a badge card reader system that controls access to the building. We have a camera system to, again, improve the security, and a burglar alarm system that was installed. We also, with the board being on our departmental network, they have access to all of the cybersecurity services that we take advantage of here at the department, such as our CrowdStrike antivirus, our Tenable tool, which is used to proactively identify cybersecurity vulnerabilities. And another example is Splunk, which is basically used as a logging system to allow us to basically, again, proactively identify any cybersecurity concerns. We also were able to replace hardware at the board in terms of kiosks that needed to be replaced. And the department has embarked upon a 5-year new computer replacement strategy where every 5 years, workforce members receive a new computer. That is important because, the new machines provide, updated and enhanced cybersecurity functions, as well as just for the operational performance is improved with newer equipment. So they are able to take advantage of that, in collaboration with us here at the department. And then we have the board's existing licensure system. LARS was migrated from an old, outdated, unpatched Linux infrastructure to a secure Windows server in January of 2024. If you can move to the next slide, please. Next slide kind of gives you a picture of the current licensure system. So there is basically a block at the beginning that shows the public interface. This is where our licensure applicants, submit their application for licenses. Then there's a database in the middle. That's the database that I just talked about being upgraded to a more secure platform. And then there's manual work that moves those applications over to another system called Milo. And Milo is what the board basically uses to do the review of applications and processing of the applications. At the bottom of the chart, you'll see that we are expecting, and I'll talk a little bit more about the new system in the new slides. We're expecting to extend out the existing LARS system through the end of June, which is where we're expecting our new system to be in place, as well as the Milo system is going to be available through June. And what we can do is we can move to the next slide, and I can provide some more specifics about the new system that we are working to implement. So the new system, we are working with a vendor by the name of MTX. That vendor we were able to get through a state contracting vehicle, the state's Salesforce contracting vehicle. So what we did is we basically put out a kind of a call for integrators to respond, all of those integrators who were on that state Salesforce contracting vehicle. We put out a call and we asked anybody who had developed a Salesforce licensing solution for a state or federal partner with a portal that served at least 200,000 constituents were invited to submit an application. And folks who submitted applications also had to commit to working with a state of Maryland minority business enterprise organization, as well as a veteran small business enterprise organization. So we had 3 responses to that call, and we ultimately selected a company, as I mentioned, by the name of MTX. That I believe we talked about, they have delivered a similar solution for the state of Wisconsin. In terms of our MBE partner, we partnered with Sequent with a 29% MBE goal, and we have partnered with 1Alpha with a 1% VSBE goal. What's on this slide basically is a quick review of sort of the technology or technological advantages that we're going to be getting with the new system. And I'll quickly run through these. So basically public safety through real-time data. The example we give here on the slide is that the new system will be able to integrate with national databases like nurses to more quickly get information about licensure of nurses in other states. We have listed here and enabled a digital first experience, meaning that no more manual forms and manual applications. Folks will be able to log in, submit their credentials online. They'll be able to go online and see the status of their applications. They'll be able to get notifications as things go from stage to stage, and then ultimately when their licenses have been processed and awarded. Also, we have called out here what improved automated compliance and regulatory accuracy. Again, the ability to now upload credentials rather than having to mail it. There are some scenarios where we'll be able to pull down credentials directly from educational institutes to even expedite the process of review and award of licenses. As I mentioned, the board is very closely partnered with our cybersecurity arm within the department. So the system will undergo a very comprehensive review from our Chief Information Security Officer and his team before it goes live. Again, protecting our cyber posture. And then lastly, I'm going to call out here this operational agility and scalability. Two things I want to call out here: the ability to scale up very quickly if we need it without any additional effort will be made possible by the new system. And if for some reason, I know there are efforts afoot to sort of be more transparent in terms of to our public in terms of how quickly we are processing licenses. So if for some reason, let's say the Department of Information Technology stood up a system where they were sort of like publishing across all licensure across the state, like the time to process, time to review, our system is very well positioned to supply that information to a do-it system if that need arose. So these are some of the technological advances that we're going to be implementing in the new system. If we can move to the next slide, I'll talk more specifically about the advantages from a transformation perspective. So really quickly, with the new system, the intent of this new system is that we're going to do this with the Board of Nursing first, but we're really intending for this system to be leveraged for as many boards as possible. So once we get the Board of Nursing sort of in place, in fact, right now we're sort of brainstorming and working on a roadmap for how we can bring in other boards to this system. There are a couple of other boards that have expressed interest in joining the platform. So if we can get as many boards as possible on this platform that the Board of Nursing will ultimately be on, we will be able to do things like, let's say someone has multiple license types, we might be able to more quickly look across the system to identify issues in different license types. That's not necessarily specifically just related to nursing. On the statewide workforce,
that also enable you to know if there had been complaints.
Yes.
About the individual.
Yes, absolutely.
Right.
Because
okay.
The system is going to also be doing complaints. So if there are complaints in multiple areas, that will allow us to more quickly and effectively get to those. I have here the statewide workforce intelligence. This is like in a scenario like if we had the pandemic, this system will allow us to really quickly and accurately identify all of the resources we have statewide to be able to help with an emergency like that. The front door item here is, again, if we can adopt this for multiple boards, it allows the licensure applicant to go to one place to apply for any healthcare license, and it's a consistent experience for them. Again, with the automation that will be implemented by this system, we'll be able to have faster turnaround times in terms of the times to process and review licenses. And the last item I have on the slide deck here is, if we can really get as many boards as possible into this, we would have one system that a whole bunch of multiple systems that we're having to have multiple bodies, supporting. We'll be able to get some cost effectiveness by, being able to have one system being leveraged for many. I see Delegate Taveras, you have a question. Happy to answer it.
Delegate
you.
Taveras.
Hi, thank you. So I think that this is really great if you could really integrate multiple licenses. What about compacts? Does it also integrate compacts with different states?
I think that would be something that's not in our current scope, but Delegate Taveras, absolutely happy to look into that, and maybe that could be a future phase in what we're planning. But really appreciate that call out. Delegate Holland.
Yes, thank you. You also mentioned that you're looking for greater horizontal integration across other boards and utilizing this technology and these processes. How successful have you been in in advocating to those other boards to adopt these types of technologies? And just thinking about, is this something that they are also pursuing, or there isn't readiness yet in moving forward in that way?
Absolutely, I appreciate that question. So I had a meeting with, I would say, a plurality of the executive directors of the board. I believe that was in November, and this topic came up. And I would say my assessment is that there is a strong desire for them, not all of the boards, but the majority of the boards to participate in the system. And that is why right now we are working out, because one of my commitments this year actually is to go out to all of the boards. I am responsible for operations at the Department of Health. So I am making the commitment this year to go out to each of the boards and just understand how can we do better in terms of HR and procurement and IT. And I think, the visits I've made so far, there've been a couple of visits. I mean, I've heard a strong desire to participate in the system. So what we are trying to do right now is sort of pull together a strategy, because what I'm being asked is, when can we get in? So what we are trying to do is we're trying to roll this out, but we're also trying to come up with a roadmap that we can work collaboratively with the other boards on, that can tell them when they might be able to get in on the system. So I am hopeful that, if we come back for another update, in a few months, I would hopefully be able to maybe show this group a roadmap of which boards are interested and when they might be able to get in, once the Board of Nursing implementation has been completed. Any additional questions? Okay, I will go to the next slide and show you guys the timeline for implementation for the Board of Nursing. So we, right now, last year, we released sort of this call for vendors to sort of participate in this process. The vendors, and we were very strict. We were like, vendors, we need you guys to bring an MBE to the table. The vendors always try to sometimes get around that, but we were very strict in that. The vendors came back and they asked for some more time to pull together their proposals. We received 3 proposals, for this. We ultimately selected a vendor by the name of MTX. This is the same vendor, as I mentioned, that has successfully done this for the state of Wisconsin. We went through all of the processes, vendor demos, ultimately purchase orders, all of that, and we were able to get this thing started, kicked off in October. Now, one of the reasons that we liked this particular approach is because when we spoke with the state of Wisconsin, we did 3 or 4 demos with them. What they're doing is they are using a similar platform. They have a department called the Department of Safety and Professional Services that is responsible for all license types, or most of the license types within the state. So they have used this type of a system, not just for healthcare, but for a plethora of license types. And one of the things that we were impressed by is that they were able to stand up 50 license types, healthcare license types, between January of 2022 and May of 2022. So 5 months, they were able to stand up 50 healthcare specific license types. They did business licenses in 2023, and then they did support for trade licenses and complaints by January of 2024. So there was a demonstrated ability to roll this out very quickly. And so I think you will see that being reflected by this timeline. So we started in October with actually working with these people, our MTX partners. We spent a couple of months making sure that we are comfortable with what they're going to be providing for us. What you will see on this timeline is something referred to as an MVP, which is the minimum viable product. So what we're doing is we're sort of working towards a MVP, a minimum viable product release, which we're expecting, and I'll walk this through a little bit more closely shortly, to happen in May of this year. And then the full thing will happen in October. Now, let me tell you what the MVP contains. So we are going to be rolling out in May licensure support for registered nurses, advanced practice registered nurses, so APRNs, licensed practical nurses, certified nursing assistants, CNAs, geriatric nursing assistant, GNAs, midwives, medical technicians, electrologists. And for these license types, we're going to be rolling out these things. So secure security platform, the ability for our licensees or our prospective applicants for license to go online and to submit their applications. Also, the ability for the Board of Nursing staff in the background to process these licenses. We're also going to now allow people to upload their credentials. So being able to store those credentials and have them available at the fingertips to the Board of Nursing teams. Tracking of payments and reconciliation of those payments to licensure will be another feature available in the MVP. Examination management, which is basically allowing us to connect to a select number of schools and automatically download educational credentials, bypassing the need in some cases for people to upload their credentials. All correspondence and notifications to our license our applicants will also be available. Delegate Rosenberg asked about complaints. We are going to have complaint functionality, meaning that folks can go online and they can submit complaints. There'll also be the ability for folks on the back end to document the results of any investigations and of any enforcement activities. So that will be available in the first phase. Very basic reporting, printing and generation of certificates, and the ability for the public to go online and look up someone's licensure will be available in the MVP. And of course, we would have to do data migration from the existing system I showed you at the beginning into the new system. So all of that is sort of the scope that we plan to have available by May. And then everything else, the things that remain that we plan to have in by October would be what we call mobile inspection management. So that is where the the Board of Nursing staff may go to a facility and actually observe practices. They will have a mobile application that they can actually enter what they observe that's fed back into the main system. We are looking to do more integrations. I mentioned something like nurses in the beginning. We may be able to have more schools that we might be able to integrate with. So more integrations is also planned for phase 2, and then more elaborate and advanced reporting. So walking through this timeline, what I kind of explained to you the difference between the MVP and the full system. So what we're doing right now as of today is we are about to begin the design of the MVP system. We expect the configuration development of that system to be done by the end of March. Between March and May, we'll be doing testing and training. And so that first MVP launch will happen in May. And then we'll do a similar development, configuration between May and July for the phase 2, testing and training between July and October. And then by October, the full system will be rolled out. And as I mentioned in the beginning, we are looking at targeting other boards. So I think in future updates, I'll be able to have for you, who are these other boards and how they fit in to a longer timeline. So I'll pause here to see if there are any questions about the new system. One thing I will add, because I know folks ask about AI, we are not necessarily implementing artificial intelligence in this version. Our goal is to get a stable system that can improve current state. Once we see that system and we have that system, I do have team members who are researching how AI can be used to sort of add an additional layer of efficiency, but that will be coming in a future phase, not the initial phases of the system. Any questions based on what I have shared today? Yes, Delegate Sullivan.
Well, I had a question for Rhonda, but Chair Rosenberg, are we going to come back to that, or am I just directing
You can
questions?
go ahead and ask your question.
Okay, thank you. So it has, we get a lot of complaints about the nursing board with the licensing problems, and we've contacted you all, and you've been helpful. Is this, we've seen some improvement, but when do you expect to really have improvement in that area?
Sure. Thank you, Delegate, for that question. So, well, I'm sorry to hear that you're still getting a lot of complaints about the board, but, again, we still have much work to be done, and we recognize that. And I think implementation of this system will make a big improvement, will help to see a big improvement, because just imagine going in, logging in, or creating an account, logging back in maybe a day or two later and seeing the exact process of where you are in your application that's been submitted. Over the years, those are some of the complaints we received, right? The timeliness of processing and communication with the board. So those are areas that we're actively working on improving. And so I anticipate with the implementation of this system, we will definitely see those complaints decrease even more.
Okay, good. So are we talking March, it looks like?
It will be May when the first version, the MVP, goes live, and then October will close us out for the Board of Nursing.
Okay, and one final question. Is there still an in-person option? Do you have humans answering phones or in the office so that nursing, the people that need licensing problems straightened out have a human to talk to or a human to go visit?
Absolutely. Our office is still open 5 days a week. We have administrative services staff that help at the front desk. We also have one-on-one assistance with the computers. We have about 4 or 5 kiosks out front where individuals who may not have access can come in and utilize that equipment to submit their applications.
Okay, thank you.
You're welcome.
Rhonda, you can take the remaining slides. Thank you so much for the time today, guys.
Thank you, Deputy Secretary. Next slide, please. One more. Thank you. So with the application processing that we just talked about, we have seen a decrease in application processing times, and that's mainly due to the addition of staff that we've been able to add to the board. Our education department, we beefed up staffing. Licensing and certification has definitely helped to led to application processing time decrease across all license and certification types. I don't have the exact numbers here, but I can tell you, for example, with our certification team, at one point we're at 4 to 6 weeks, and we're now down to less than 2 weeks, and that's business days. So we've made a significant dent in processing times. And as previously stated, once the licensing system goes into effect, we anticipate the timeframes to go down even more. The board has also supported legislation to streamline endorsement processing. So in 2025, there was a legislation passed that went into effect on October 1st that permits individuals with an active unencumbered multi-state license to qualify for an endorsement license without having to present evidence of educational background. So that was a significant delay, and that has been addressed with this legislation that the board supported. Next slide, please. One more. And so part of the 2 independent evaluations also involved looking at the board's fiscal management. Next slide, please. And one of the things that working with the department has done, the department initially had provided assistance with a budget team member to help analyze the budgetary needs of the board and help with budget forecasting, and ascertain and reviewed any on a historical and future trending basis. And so the board is currently looking across all license types and engaging stakeholders prior to presenting formal fee proposals or increases. So we engage stakeholders throughout that process. Next slide, please.
If I may, does a fee increase, can that be done by administrative action, or do you need statutory approval?
It's in regulations. It's in
Okay.
statute and then regulations. Yes,
So it'd be AELR, not the full General Assembly.
correct.
Okay.
Yes. And Delegate Schlega, you have another question?
Yeah, sorry about that.
Sure.
Are you, then it sounds like you're contemplating raising the fees.
So what we've done is a phased approach, right? And so the first phase was raising fees for RNs and LPNs, which went into effect July 1st of last year. We haven't made any specific formal proposals at this time to move forward, but at the point that we do, we will engage. And we did engage stakeholders in getting their feedback before submitting the formal proposals.
Okay, I would assume they were all opposed to you raising their fees. So-
Many were. Absolutely. No one has ever thanked you for raising fees.
Okay, good.
But they
Okay.
are in support of the board having more resources to serve them better. So I think
Okay, thank you.
thank you. All right. Next slide, please. So with regards to complaints and investigations, if you could go ahead and advance one more slide. One more slide, I'm sorry. So one of the things that the department assisted us with is in that area was adding additional non-nurse investigator positions, which we didn't have prior. And that was one of the recommendations that we did receive to help, with investigating complaints, clearing backlogs and things like that. We are currently actively recruiting for 6 investigator positions. And in addition to addressing the staffing issues, we looked at streamlining processes as well. The board also voted to delegate authority to the board investigative staff to administratively close cases that were 2019 and older. This was in January of 2024. These are cases that were reviewed. Each individual case was reviewed, and looking at those cases, there was either the person was no longer practicing or had expired, or there was no evidence or anything that could support moving forward with the complaint. And then the board also delegated authority to complaints and investigation staff to triage new cases and assign priority levels. So that triage point was also an area that was identified in delaying these complaints moving forward. And this new process with intake to triage time has decreased from 58 days to under 24 business hours. And so we've been able to, with the current staff, which we still need more, but we have been able to significantly decrease our open complaint cases. Next slide, please. And next slide. And as you heard, with staffing, we have been able to improve processing times and also improve the processing of complaints. Next slide. I mentioned that we've also implemented and revised standard operating procedures, which is currently used by staff. And this is just to standardize on and the onboarding of new employees more effectively, which was also one of the recommendations we received. Next slide. So we thought it would be helpful to also just talk about some additional accomplishments, because it's not just about adding staff members to the team. It's also about ensuring and minimizing staff turnover. So we look at employee engagement, employee satisfaction, team building events, meetings. We solicit feedback from our staff on certain procedures and policies and things like that. Community outreach, just to ascertain job satisfaction and improve that for our team members. Next slide, please. And this is just a summary of what we've already discussed about certification and licensure and the increase in staffing and decreased processing times. Increasing community and stakeholder outreach is a big one, because we engage our team members, the frontline staff who do the work every day, to also present at these different town halls and things that we put on for the community. We've also updated our webpage with clear and direct instructions for applicants. Next slide, please. And I think this might be the final one. So as mentioned, with engagement with constituents and stakeholders has been a big plus for us. It's also, like I said, helped our staff to just improve their job satisfaction, to know that they're able to do this and engage directly. Town hall meetings have been held for the past 2 years with our CNA training programs, with licensure. We're going to continue to add more town hall meetings for our education department. We've established a customer service email for direct engagement with constituents with immediate response and follow-up. And again, those public feedback sessions where we engage our stakeholders and constituents as well. And that concludes the presentation. Any questions?
I have a question if there are not any from any of the members of the subcommittee or members of the House. Current case is 966 as of last week. Is that a high number for a board, a MDH board?
Well, it's hard to answer that because, that's a pretty relative question when you look at the number of cases, and I can certainly supply the subcommittee with that information on how many cases we've received. But what I will say, when you compare it to our previous cases, it's a lot lower, right? If you look at, we were almost at 1,500 about 2 years ago
Yes,
this
sure.
time. So yeah, we're working diligently though to get those numbers down.
But it says something about the profession or interaction with the public that the number would be so high. Nothing negative about the board itself.
No, and it's just so, and keep in mind that these cases, as they come in, they're ranked in order of priority, which the priority is determined by the risk of harm to staff, to the public. And so what the triage staff will do is look at those cases and rank them, and in accordance with the National Council for State Boards of Nursing guidance document. And that will help to wean out those that are priority one, that are high risk. And of course, those would be most of our resources are focused on those cases first.
Okay. Any other questions? Seeing none, we thank you very much. And we will move on to the next board, which is morticians and funeral directors.
Thank you again.
Thank you.
I can continue sharing on my screen, but if you wanted to take over the presentation, I believe Sam has changed the settings.
Okay. So I can present. Give me one moment. Share. Back. Here we go.
You zoomed up too much.
Okay, I don't know if everyone can see what I am presenting.
Yes, we can see
I
your
was just
email.
expecting.
And
Okay.
now we have your correspondence. I don't
Yes.
think you want to share that.
Yeah, I'm seeing your
Right.
email, Erica.
Yeah.
Okay, here we go. Okay, give me 1 second. Here we go.
Okie doke.
There we are. So you all have access to the PowerPoint, which I assume would be presented, and I would just speak on it. So give me one more.
Sure.
Okay. And then I actually had something separate I was going to speak on, so I don't know if you all will have access to that as well.
Erica, is it easier if I try to share the presentation?
Yes, can you share the actual PowerPoint and then my separate testimony I can put up? Because there are particular points that I want to discuss that's not in the PowerPoint. I think I can stop. So I stop share and then you should be able to access the share.
Yeah, I'm just finding it in my email. Sorry.
It is okay. Thank you all for your patience.
In the
Right.
meantime, we can introduce ourselves.
Yes, in the meantime, I will introduce myself. I am the Executive Director of the Maryland Board of Morticians and Funeral Directors, and
I am Charlotte Persephone Hoffman, the first Vice President of the Board of Morticians and Funeral Directors. And I am sometimes before this committee in another capacity, but today I am here for this.
well, which is important is that she is also the chair of our complaint committee and our legislative committee, which is important in this slide as well.
I think both Delegate White Holland and I also have special guests. Do you want to say hi, Malcolm?
Um, this is-
Oh, look.
Yes,
Look.
baby Riley.
Baby Riley wants to play in the snow. All right.
Erica, I'm seeing the Zoom link in the email, but I'm not finding the presentation.
Okay,
It's
I
like-
am
Charlotte,
going.
Could
I
we just
have
go
your
back
slides
to
here if
Delegate
you want me to.
Rosenberg's
Okay,
step?
yeah, if you want to
got
just
it.
share
Okay.
them, sorry.
I'll share them, no problem.
It's just for whatever reason not showing up in my, like, I have the email open and I was like, I know this was in here earlier and it's just hiding from me now. I'm sorry.
I am sharing it again.
There
Here
we
go.
are. Perfect. Sorry for everyone for that confusion. I wasn't ready for it because I didn't realize I was doing it. And yeah.
Okay, here we go. Okay. Well, thank you all, Chair, Vice Chair, members of the committee. Thank you all for the opportunity to speak today. The elephant in the room that nobody wants to address. So last year, January 10th, 2025, unfortunately, the board under my authority conducted an investigation and inspection of Heaven-Bound Crematory Services in Charles County. And during that inspection, the board's sole inspector identified serious public health and safety concerns, including improperly stored human remains, unsanitary conditions, etc. These conditions pose an immediate risk to public health and compromise the dignity of the deceased. Is when we found out about that as our board, we reached out to the sources that we could reach out to get extra authority that we currently couldn't execute at that particular time. As a result, the board did do an emergency authority and issued a summary suspension of the facility's crematory permit. This action was not an isolated event. This establishment did have previous disciplinaries, including fines and probation previously. And the violations ended up continuing, and we found the violations. The current staff and administration found the violations under my direction. So the board ended up revoking this license of this crematory and the licenses of the two licensees operating the crematory. That was the result from that and the accomplishments that we did obtain regarding that license. And the reason that brought us here today. At the time of inspection, I want to make known that the board had only one investigator that was responsible for overseeing approximately almost 300 funeral establishments statewide. That individual still manages routine inspections, in addition, complaint investigations and emergency responses. This staffing has been limited for over at least 4 years. Think about it.
One quick thing to add there is that there was a significant backlog of inspections during the COVID epidemic.
Yeah, I was
pandemic.
getting
Sorry.
into that. That was part of what I was going to state. So during that time, at the time of inspection, the board had only one investigator who was responsible for overseeing approximately 300 funeral establishments statewide. And he managed so that in several other complaints, investigations, routine inspections, and emergency responses. And this has been existed for several years prior to our newly assigned administration. And it was identified back in 2016, and it's only been addressed until recently under my oversight. And so following the issue with the previous crematory, which was heaven bound, Governor Moore ended up addressing it by directly and immediately performing an audit and operational review of the board in January of 2025, and the board fully cooperated. Since that time, we have actively implemented significant administrative improvements, including transitioning inspections and licensing to fully online systems where it's easier for people to do an inspection, to request an inspection, for us to do our complaints and whatnot. We've completed a substantial backlog of overdue inspections with limited resources. Therefore, the 300 backlogged inspections have been completed, and they were completed in less than the time that was allotted for us of completion, which is less than a year. And we've recently obtained an approval for a contractual part-time investigator, which is what is needed for our staff, for us to function, for us to proceed with investigations in the proper format that it should be complied with. And in that particular position will focus on compliance management, and it will be filled shortly. It has been posted. I have to conduct interviews and investigations and whatnot, and then that person will be selected shortly, and they'll be added to our team. As a result of everything we've done administrative, operationally, we do, however, as our board, we still have critical challenges that remain, and they're all legislative. I've done what I can do administrative and operationally, in which in our PowerPoints I will present, but under our current law and statutes, there are particular things that I did not mention on the PowerPoint, but do need to be addressed statute-wise. And
Will legislation be introduced, excuse me, will legislation be introduced this session to address those issues?
I am definitely hoping that they are. So it was Health Bill 1555. Charlotte, if you want to jump in and talk any more about it, but it was a bill that was introduced in 2025 that addressed several issues, and they were brought up by the investigation and audit that was done under the governor. And those particular statutes that were recommended that the board voted and agreed on, they were not approved. They were approved through the House and not the Senate. So if we can get support in those, it would be greatly appreciated. It's basically allowing the board to have more authority to discipline, and that's not going through a systematic process.
So what's been happening this year is because basically House Bill 1555 came in after all of the usual deadlines last year. You can probably guess that from the extremely high number of the bill. And so by the time it got to the Senate, it just didn't have time to make its way through. This year, the Senate Finance Committee has been taking the issue up on their end. We've had a number of discussions with them about the legislative changes we need. My understanding was that there was sort of a back end thing that was working on where finance was coming up with an iteration of it, which then would come over to the House, since the issue last year was that it passed the House but not the Senate. I do not have an extreme up to date update on what's happening with that draft Senate bill, but we do believe that we should be seeing something shortly.
Okay, so
So
Charlotte,
if you may or may not know, we have a deadline of February 12th for a bill
Mhm.
to be introduced to be guaranteed a hearing. So, and it sounds like you're working with an understanding of that. The Senate committee would be aware of that.
Yes, we've been working directly with the Senate Finance Committee and committee staff on this.
Okay, thank you.
So they should be meeting their deadlines on that. And if they do not, it is because they do not meet their deadlines, not because
Mhm.
of our lack of working with them.
Okay.
okay, if you can go to the next slide, Charlotte,
Oh, I'm not. There we go.
or
Yeah.
whoever else is on here. Okay. Thank you. Okay. So after speaking with Mr. Shaler, who was assigned by the governor, he definitely issued 4 that urgent recommendations addressing critical reforms, and they were all legislative and had to do with our statutes. He recommended 14 additional things that were aimed at improving overall operations. And some of them were administrative and operational. So I am proud to say that we have fully addressed everything that was administrative and operational. Everything that we were allowed to change, we changed. And on the next slide, if the slide can be changed. These are several examples that are listed on our next slide for your reference that we have changed. And to address them, if I had to address them individually, these took a lot of time and they were done in less than a year with limited time, limited resources, and limited staffing. So the board has transitioned their inspections and their licensing system to fully online platform, and that creates a more streamlined and efficient process for both licensees and for the board staff. So it makes it easier for us, it makes it easier for the licensees. Before everything was, it was mailed in. So these constituents had to fill out a form that was 4 or 5 pages mailed in. We had to open it, scan it, and whatnot, whereas though they can just fill it out online, enter their information, and it's an easier process and it's more user-friendly where they can and have no doubt about submitting their complaints and whatnot. So we also, as I mentioned before, there were over 300 past due inspections at the time that we had our meeting in January of 2025. Matter of fact, February 14th. I mentioned this that it was on Valentine's Day. I met with you all almost a year ago. And since then, we completed our past due inspections. They were actually completed in October or November of this year, of last year of 2025. So the board has also transitioned their platform. So all of our licensing fees, our applications, any financial requirements are paid electronically. The complaints are also fully automated, which I mentioned before. The board has better communication with the county health departments. I recently had a meeting with the Department of Environment, one of the local health departments, and one of the things that we've implemented is when we do get a complaint, we feel as though it might turn into something egregious and we want to reach out, we're giving that information to the local health department so they're aware. So if something does come abrupt where we have to reach out to them, they already have the information of that licensee that might not be in compliance, but because we have a particular format we have to follow as far as our regulations and our statutes, we might not be able to do anything, but we put the information out to these particular departments to see if they can take action prior than we can. And then the board has also implemented changes to the meeting format. We, at one point in time, since COVID, the board's never met in person. So I implemented something where we at least, if not meeting every month, we meet quarterly, which has been a very detrimental and crucial part to us meeting in person. It's more personable. We're actually getting, a lot of things more accomplished. And in addition to the meeting format with our monthly open sessions, we've also been having more frequent complaint committee meetings. They were initially once a month, and we have them every 2 weeks. So those are implementations, just some of them out of the several that the governor had recommended that we accomplished all of them in less than a year, might I add. And that is for the most part how I'd like to end this, but also adding that we do want the support legislatively. A lot of things that we can continue that our board has voted on and recommended. We have several statutes that need to be changed. I've listed them specifically on my side. I didn't put them in the slideshow because I really wanted to focus on the improvements and everything that we've accomplished in a short amount of time with limited staffing, limited resources. But if we had the resources, then we can accomplish certain statutory state changes that are necessary for our board. And there are 4 out of maybe 7 or 8 that were recommended by Mr. Shaler, who was assigned by the governor, that our board agreed on, that we need more access to being able to discipline licensees instead of going through this long-term process where it delays their disciplinaries. And does anyone have any questions?
Yes, the chair will recognize Delegate Tavares, and then Delegate White Holland.
Thank you, Mr.
get you there.
Chair.
Yeah.
Thank you. The question I have is, where are you on separating morticians from funeral directors? I understand that Senator West has a bill recommending this. And so I just was not familiar with this, and so I just want to kick it back and find out where you guys are on this.
Okay, so I'm not familiar with that particular bill. It hasn't been presented to us yet, but I do know the difference in a mortician is that morticians embalm. Funeral directors do not. So that's the difference. That's the only difference between the two as far as licensure with the state.
Could you repeat that just so I try to remember it?
So a mortician with us, they embalm. So they have the right, they go through a particular test, which is a practical exam, and they have the right to embalm. A funeral director does everything a mortician does except for embalm. So they go through the same educational requirements, the same testing besides the embalming testing, and it's not the state
And
exam, which is the jurisprudence. It's a
is
practical exam.
is there a religious exemption for a mortician whose faith does not permit him or her to perform embalming?
We don't have anything particular in our statute at this time.
Okay.
Um,
I'm not
Typically,
drafting
Charlotte,
such a bill.
I don't
Remember
believe.
that issue coming up.
typically what would
Yeah.
happen is the person in that situation, if they're not performing embalmings, they would register as a funeral director.
Mhm.
I just looked through the bills that Senator West has already filed this session, and I do not see that one yet. So it might be something that is still at bill drafting. Once we see it, we can certainly provide further commentary. I will say that because of how closely related the business of being a mortician and the business of being a funeral director are, it certainly makes sense for them to be regulated by the same board. But we do have separate uh, licensing statuses for those two different classifications.
Okay. Thank you. Delegate White Holland, followed by Delegate Saliga.
Yes, thank you, Mr. Chair. And part of my camera being off, it's eating time with the deputy delegate. Nonetheless,
We
I
appreciate your
appreciate.
camera being off. Yes.
Yes, of course. I appreciate this update and applaud the work that you've done to get things back on track. And I appreciate you also elevating that the board has had better communication with our local county departments of health. I know that you referenced that there was a liaison or a legal advisor in the governor's office that you all have been corresponding with and working with. Is that still in place, or how have communications strengthened in the governor's office in your collaboration and work with that office as well?
It's definitely been positive. What I didn't include is that 5 members of our board was removed during this process and this evaluation and audit. And since then, all 5 board members that were removed were replaced. So I've been in regular communications with the appointments office, and they were proactive in replacing those members, and they have all been replaced since that occasion has happened. Since then, I've been in communications with the new deputy secretary for the Department of Health, and the chief of staff. We've had meetings, we've had correspondence. I've been in correspondence with the Department of Environment. They've made particular recommendations for other agencies, whereas though if they can't suffice in answer to certain things, that I've been reaching out for, they can point me to the correct department that can. So I've had good communications, networking, giving them an understanding of where we are and trying to be proactive and not reactive in particular situations with licensees, whereas though we have jurisdiction, but we don't have immediate action to respond to this, like disciplinary wise, as far as licensees, unfortunately.
Thank you. And Mr. Chair, may I follow up?
Certainly.
And just very briefly, given all that you've accomplished, is there something else that you might need and to better position the board for success as you're here again before legislators, just trying to think about what are some of the key next steps or actions that you all are looking to take and how we might be of assistance to you?
Um, it's funny you said that. I do, I actually do have a list of, there were at least like 8 statutory requirements that were presented to us, and there are 4 essential ones that would give our board, it would give us very good leeway as far as us executing disciplinary that's needed for people and being proactive for any of these licensees that feel as though they can violate and then they can file an appeal. One of the things that, matter of fact, if you want me to list them, one of the things is like filing an appeal. So if we file a disciplinary and we feel as though someone is at fault and we go through our regulations, we go through the statute, they have the obligation to, they have the authority to file an appeal. So they'll file an appeal and that prolongs our disciplinary process, whereas though now we have to go to the prosecutor's office. Now we have to involve several people. Now they're involving lawyers and it pushes out their disciplinary. But we're dealing with this person in addition to several other disciplinaries that we're getting against other licensees. So,
If I may add to that really fast,
yeah.
this is the specific issue that we are finding with the appeal provision is there is a provision in the Mortician Board statute that does not exist in any other like health occupation statute that says that if we summarily suspend a license of a licensee, that the second they appeal, that decision of the board is stayed. So every other board can summarily suspend licenses, and then the licensee gets to appeal, and they can ultimately get their license back if the board is found to have acted inappropriately. If in our case that order is immediately suspended. And so we can have people who are doing rather egregious things who we effectively cannot take the action of summarily suspending them because it has no effect. So instead, we're having to go through a much longer process with the administrative prosecutor's office to bring more formal charges, et cetera. So that is something that, again, exists only for us and for no other board.
Mhm.
Okay, Delegate Saliga, or have you asked your questions, done with your questions?
Sorry, I was having trouble getting my
No
mute
problem.
button fixed. Good to see you all. Thank you. I appreciate your hard work. We know that, clearly heaven bound and, the bill, all the things we worked on last year, sounds like things are going in the right direction. Kudos on getting up to date on those overdue inspections. That was a yeoman's job. Good job on that. Now, I know you had mentioned, Erica, that the board had, some changeover. We sent a letter, the Freedom Caucus sent a letter about concerns over those board positions being vacant for so very long. I think it was about 9 months that the licensee positions were vacant. So you're, just to reiterate, you said they're fully appointed. You're probably waiting for them to go through the Senate. Can you give us an update on that?
The update is that they're on the board. They have been gone through their orientations. They've received their certifications and they're on the board. They are actively attending at least, I think all of them have at least attended 1 to 2 board meetings now. And they're actively involved in the committee meetings and the decision making with our closed session regarding any complaints that have been issued. which is a great help because the subject matter experts are needed.
Absolutely. That was our concern, that those board positions, the professional board positions, had been vacant so long. You finally, last question, you mentioned budget. And I know we had looked at that with Mr. Sheeler, when we kind of did he did the deep dive on what was going on. And if I recall, there was the licensing, the fee structure would be like a lot one year, hardly anything the next. Have you fixed that problem?
So that problem is in our statute. So it's also an issue that has to be addressed because in our statutes, it has that it's a, odd and even year for particular licenses. And certain licenses are renewed on an even year, which is majority of our licenses. And then we only have one license, which is the mortician's license that's renewed every year, which is done on an odd year. So we have 12 different licensure types, and we only have one that's renewed on an odd year, but that is based on our statute. So it's something that has to be changed through that. So it's another thing that needs to be addressed in a bill. Unfortunately, that's something that if I could do it administratively and operationally wise, I would have accomplished that with the other requests, but that's something that unfortunately I don't have control over.
Do we have a bill? Do you all have a bill? Who would be responsible for putting that together to fix that problem, to help even out your funding?
It wasn't a part of, I think it was, it was, I believe it was a part of Health Bill 1555. It might have been added. If it wasn't added, it definitely was a part of the governor's, audit request that Mr. Shaler did. So I'm not sure. Charlotte, do we have to present a separate bill for that? Do you know?
I don't remember it being in a HB 1555. We can make sure to raise this specific issue with the folks in the Senate to see if they can get that into their bill. I will note also that we have had extensive conversations with the broader Department of Health and the governor's office about reworking our regulations, setting our fees. So we can't change the payment schedule, but we can, in theory, change the fees that are charged. And at this point, they haven't been changed since at least 2015. So there's been quite a lot of inflation since that point. We sent a proposal to the Department of Health increasing the fees. They actually sent it back to us and said, you need to increase them more. That is in order to, sort of do everything and match inflation, et cetera. That is pending. My understanding is that that was sent to the governor's office and it's sort of sitting at the moment, but hopefully we can get some movement on that at some point in the next year so that we can start increasing some of the revenue that we're receiving from fees.
Okay, and do you have a sunset review this year? Are we gonna, if I recall from 1555, that there was something about when your sunset review was coming up?
I believe it's in 2027 fiscal year, either 2027 or 2028. But it is upcoming and we have to prepare for that as well.
Thank you, Mr. Chair.
Thank you. Okay, is there anything further regarding morticians and funeral directors from the members of the committee, subcommittee? If not, we thank everyone from the department very much. You can relax. Board of Social Work Examiners, our final presentation. We have Karen Richards, the executive director, and Kevin Meenan, the board chair, who is available for questions. Please begin. Ms. Richards.
Good afternoon. I think Kevin I'm Karen Richards. I'm the executive director with the Board of Social Work Examiners. Also with me is Kevin Meenan. He is our current board chair. Kevin, do you want to share the presentation? And we can share it because Kevin's set to do it.
Excuse me, it looks like someone already is.
Oh, they
So
are.
I
Okay.
will defer.
Yeah,
Thank
if you want to take
Okay.
over, you can, but I'm also happy to share as well.
It's okay. I appreciate you already doing it.
You
All right,
got
no
it?
problem.
All right.
Thank you.
All right. Well, thank you. And thank you, Chair and committee members, for the opportunity for us to present today. If you could switch to the next slide, please. I just want to, with the committee, because we understand that there's a concern about workforce shortages in the behavioral health field, of which licensed social workers play a critical role in that. So we want to just reiterate the board's role, which is to protect the citizens of Maryland through licensing social work applicants and disciplining licensees. We also want to highlight the fact that we did support the social work compact legislation, which passed in 2025. And this will serve to increase the number of social workers available to provide telehealth services to Maryland citizens. And finally, what we're working to do is improve customer service for our applicants and for our current licensees. Next slide, please. Some of the things that we have done at the board in the last year is we have added staff and the licensing unit. When I first came on in fiscal year 25, we hired 2 part-time contractual social workers to process our backlog LCSW-C applications. And we're happy to report that, our average time now on an LCSW-C application for processing is 45 days, which is well within our COMAR regulations of 60 days. I created a new part-time licensing coordinator position and actually brought back a retired licensing coordinator, had worked at the board for several years, just to give extra support to the unit. And our licensing unit is now fully staffed. And I also want to add that one of the part-time social workers, she stepped into the role as social work supervisor when we were able to promote the current social work supervisor to the director's role when she retired last year. In the compliance unit, we added 2 full-time health investigator PINs in fiscal year 25, and now the unit has 4 investigators full-time. 1 is currently vacant, but we are in the process of interviewing to refill that position. And this has really been significant in improving the customer service, answering our phone calls, again, addressing backlog, and just overall among the board staff. Morale has improved, and I really do think that in terms of the board staffing, we're definitely moving in the right direction, and that is only going to serve to improve our response to licensees. Next slide, please. So just some quick demographics. You have this slide, but I do just want to highlight the fact that in 2024, we had 18,916 active licensees. These are active licensees. And then in 2025, there's 20,282. And again, that's an increase of a little over 1,300 active licensees in Maryland. Next slide, please. And the interstate social work compact. So the board is getting ready. We have attended the compact commission meetings. There are currently 31 states in the compact, including Virginia and Delaware. DC currently has pending legislation, and I believe Pennsylvania has pending legislation as well, which will be very beneficial to Maryland licensees to be able to serve clients in neighboring jurisdictions. The rules have been promulgated and a database provider has been selected. The commission is hoping that the first states will start issuing multi-state licenses in 2026. It's important to note that the commission did vote on September 5th, 2025 to use the ASWB exam as the qualifying national exam. It's also important to note that for the social work compact, some health occupation compacts are a little bit different, where the licensee might go to the compact's database and apply. For the social work compact, they are going to apply through their home state or anchor state. So Maryland licensees will come to our board to apply for the multi-state license. We will have to verify that they meet the requirements, and then they will have to pay a fee to the board, and we will a fee that will be shared with the compact commission as well. Again, we are not issuing licensing like the multi-state license yet, but we are in preparation for that. Next slide, please. And again, the ASWB exam, we know that there's the controversy with the research from 2022, and I'm not going to go into that again here. It's been well discussed, but we do want to highlight the fact that two facts actually I'd like to highlight. First, the board is a member of ASWB, as are all social work boards throughout the country and also outside of the country, including Canadian provinces. So we're a member, and this is the national qualifying exam are done through ASWB. They have made changes. They've taken time, and these changes will be coming in August of 2026. The new exams will test 3 content areas instead of 4. They'll have fewer questions, include more 3-option multi-choice items, focus more on problem solving, and they will retain the 4-hour limit. Next slide, please. Compliance. Just going to highlight briefly because, again, in the 2019 legislative audit, we were listed as having a backlog of complaints. Our board does handle a large number of complaints. These are some of the areas complaints. The average number of complaints per year for the last 3 years is 173. I do want to highlight that we started a new Smartsheet compliance database this year. So that is helping us kind of track some of the data on the complaints. We changed some things around continuing education audits. For example, they used to come to the compliance unit and require investigation, and that really added to the number of complaints. And working with our board legal counsel, we have developed a disciplinary method for the failed CE audits. CE is continuing education. For the failed continuing education audits, to kind of handle them through letters of admonishments. And again, this is kind of a way of kind of streamlining the process for the continuing education audits. And it's also taken a burden off of the compliance unit so that they can focus on these more very serious type of complaints, as you can see here. Again, our average number of complaints per year for the last 3 years was, when I averaged the numbers together, was 173. We did also, I averaged the numbers for closed cases from the last 3 years. We've closed 181. And of course, that would have included some of the backlog cases. So our numbers are going in the right direction. For example, in 2025, we have 108 cases under investigation from 2025 that are still under investigation. We closed 112 cases, and we have 27 of those cases from 2025 down at the Office of Attorney Generals for prosecution. So again, with the addition of the health investigators, streamlining some processes, we are definitely working towards addressing the complaint backlog. Next slide. Thank you. And I'm happy to take any questions.
I don't see any raised hands at the moment. Are there any questions from members of the subcommittee or any other House members? Delegate Hutchinson.
I'm fine. Thank you for the opportunity.
Certainly, certainly. We welcome you. All right. If I may, in summary, and certainly open to comment from my colleagues on the subcommittee, I would think that the appropriate, in terms of next steps, that for the Board of Nursing, OPEGA stands for, they did an evaluation last year, the Office of Program Evaluation and Government Accountability, which is within our Department of Legislative Services. I would suggest that they do a follow-up evaluation of the status of that board, given they made the original evaluation. I'll be with you in a moment, Delegate Tavares. I see you. In terms of morticians and funeral directors, we have heard that there is legislation before the Senate, and that presumably will get over to us, and that would be the appropriate avenue to address the issues that have been raised regarding morticians and funeral directors. And I have an open mind about the Board of Social Work Examiners, whether we need legislation or we need an administrative evaluation. So that would be a motion, and I accept any comments. Delegate Tavares.
Thank you, Mr. Chair. I don't think I saw the PowerPoint. Can you make sure that we get that? That's my first comment. And I wasn't very involved in this process. Well, first because I wasn't part of this committee, but I do know that Delegate Woods was, and I'm just questioning whether is she still going to be part of this group as it moves forward and having conversations regarding improving the diversity of, I mean, because it's very stark in the numbers that you present that there aren't a lot of Black and brown
social workers
in the industry, and we are in desperate need of that at this time, more so now than ever.
Mm-hmm. Well, Delegate Woods is invited to join us. She would not have a vote, however, as not being a member of the subcommittee, unless she wishes to have that changed by the full committee chair. And that would be her decision, the chair's decision.
Mm-hmm.
And I believe we'll make sure, Lindsay, can you send out the
Yeah, can I interject on a couple of things?
Sure, absolutely.
So first, we're sad to lose her, but Delegate Woods is actually not a member of the Health Committee anymore. Not just not a member of the subcommittee, but she's not a member of our full committee anymore. Not to say that she certainly can't work on bills that come before the committee, but I'm just keep that in mind. I will go ahead and make sure everybody has the slides again from today. And then as far as workflow for the Office of Program Evaluation and Government Accountability, the way that work is assigned to them is set in statute. Delegate Rosenberg, you and I can have a conversation about that offline, but it's more than just the subcommittee asking them to do something. But they did do a review of the Board of Nursing a couple years ago. I don't think anyone from the Board of Nursing is still on this call right now. Oh no, Rhonda is there. I'm sorry, Rhonda, I missed you. But I don't know that there's a role for OPIG at this point unless something happens at a higher level.
Lindsay, if we could just make sure that I get it in both emails. Marcos has both of my emails.
Okay, thank you.
Thank you.
All right, well then, if existing law does not permit us, if I'm hearing Council Lindsay Rowe correctly, existing law does not permit us to refer this, the Board of Nursing to OPEGA at this time. I would modify my motion to simply say we will await the recommendation. We will await legislation coming over from the Senate on the Board of Morticians and Funeral Directors, and any legislation dealing with any of the three boards that have been the subject of our hearing today. So is there any member of the subcommittee who has a recommendation for anything beyond that? And we will get back to the subcommittee regarding the issue of OPEGA. Hearing no comments, no raised hands, virtual or otherwise.
I was having trouble raising my hand. I'm sorry.
Okay, go ahead.
Mr. Chair, I would like to know what the increased fees that are going to be recommended for the Board of Morticians and Funeral Directors.
Okay, that will ultimately go to AELR, is that correct? Is there some,
Yes, so we it got denied because we needed to increase our fees. We increased the fees. They were posted and it was comment. And then I just found out recently, I believe it just got approved by the secretary. Maybe a few days ago. Jordan, is Jordan on here? I think Jordan was included in that. But it just got approved a few days ago by the secretary, and if it could go through, perfect.
are you at liberty now before this body to say what the increase is, or does that have to wait?
There are different increases. So we have 12 different licensures. That's abnormal from the average board, which typically has about 2, 3, maybe at least 4. So it's different from each licensure, and there's nothing that is consistent. I can't say, hey, this increased by $30, this increased by 100. So if I do have it up, if you would like me to go through each individual.
Not right now. If you
I'm
can
about
just
to
send
say,
it to
it's-
us. Yeah,
Yeah,
I'm
I
not
can
going to
send
belabor
it.
it, but and then what can we do to help straighten out your budget? So, I don't know who we need to talk to, but as the chair, Rosenberg said, tick tock, we've got like 2 weeks to put a bill request in.
Right. So our
but
fees are
yeah,
something.
we'd
yeah.
like to help fix that consistency on your budget, and that may help lessen the burden to continue increasing your fees. Thank you.
Yeah, so those fees are definitely something that needs to be increased. There was an email that was sent. It showed a breakdown. I don't know, Jordan, you're on here, but it does show a breakdown. I don't know what I can share and what I can't share.
Don't share anything then.
How about this?
You can get it to
No,
us
you're-
later. Yeah, just provide
Yeah.
it to us later would be adequate. Thank you. But again, what can we do to help you, flatten out your budget so you're not seeing those, wild changes from an odd to an even year? Thank
Yeah.
you.
Thank you.
All right. Is there a motion to adjourn?
Motion to adjourn.
Second.
Oh, that's right. You've got to be somewhere in an hour and 9 minutes.
Yeah, and I have a hearing at 2, so. before
Okay,
that. All
very
right.
good. All right, there being no objection to the motion to adjourn, we stand adjourned. Thank you all very, very much.
Thank you.
Thank
Both members and